Hey guys, how are you? Dr. Shah here, consultant rheumatologist. Today I'm just discussing a very basic thing. Obviously, a lot of people do not understand exactly what is arthritis, what is rheumatology. A lot of people think the arthritis is a one disease or it is the only one disease. Each people suffer same arthritis. So let me tell you, arthritis are the various types. There are 100 arthritis which affect different people over the different times. Rheumatology is basically the field. We are the physicians. Now, sometimes people even confuse with the rheumatologist with the orthopedics. We are the physician. We treat with the drugs. We treat certain number of the diseases or conditions like arthritis. Obviously, it's a inflammatory diseases versus non-inflammatory diseases. This is the basic concept I'm telling here. The arthritis diseases, we as a rheumatologist deal soft tissue arthritis or soft tissue rheumatism. Then number of the joint conditions which are non-inflammatory. I can tell few of this like osteoarthritis, which is a non-inflammatory. Inflammatory diseases like rheumatoid arthritis, like psoriatic arthritis, ankylosing spondylitis. Then there are a number of other conditions like connective tissue diseases. We deal certainly a large number of the connective tissue diseases, among them a few common diseases like systemic lupus erythematosus, SLE, we call it as a lupus. Now lupus is a broad term. It affects the skin, it affects the joints and certainly other organs. Systemic sclerosis, this is another autoimmune condition. And then Sjogren's syndrome, mixed connective tissue diseases, overlap syndromes. And then there are muscle conditions, inflammatory muscle diseases, in which there is a inflammation in the muscle and people feel fatigued, tired, and progressively they become housebound. They have a difficulty to standing from the sitting position. Then there are very common diseases. Obviously, they are in the like a European. Certainly, geography can also impact the disease, like crystal arthritis. The two most common things: gout, pseudo gout. Then there are a number of the conditions, and very important thing in rheumatology is called as vasculitis. So vasculitis is a simple term, but it has a number of the subgroups. It means the inflammation in the blood vessels. So a number of the diseases which can fall in this condition, few common. Takayasu arthritis, which is the younger people, affect the blood vessels. Then is a temporal arthritis, GCA, temporal arthritis, common in the European countries above age 50. Then a number of the other vasculitis which can also be the part of the inflammatory arthritis. It can be the part of lupus. It can be alone. These vasculitis affects the brain, eye, lung, abdomen, kidney, virtually a lot of skin, a lot of the different variants, different conditions. Then there is a very rare diseases also. We do see Behçet disease, familial Mediterranean fever, Trapp syndrome, and a lot of other rare diseases. Nowadays there is another autoimmune vasculitic condition, IgG4 disease. So arthritis, basically a lot of people think it is the only rheumatoid arthritis they suffer. Now the presentation can be similar, can be different. Most of the time there is a degenerative arthritis like osteoarthritis, which is a wear and tear. It usually affects in the late 40s and 50s, while rheumatoid arthritis it can affect age 20, it can affect in the age 80. It's more with the swelling, red, hot, tender joints. So we differentiate. Obviously, there is, as I say, is 100 arthritis, viral arthritis, arthritis due to secondary, liver diseases, lung diseases, sarcoidosis, one of the, inflammatory condition which affects the lungs. It can affect the joints. It affects the brain. So in this way, arthritis are different. We as a rheumatologist deal with the drugs. A lot of old drugs are available, and there is various numerous latest drugs available in the market. When we diagnose, we as experts, because we as experts, these biologics, we call it as a biologics, the newer drugs available in the market, which can help a lot. One more important thing, a lot of the YouTube videos, you can see a lot of people talking about that if you eat this thing, your arthritis will go away. If you do this, or your arthritis will go away. Now, one thing is a very important. Now, these arthritis or connective tissue diseases can have a naturally low level inflammation time, and certainly it can make a flare. There may be a few years when there is a no inflammation, and then there is a suddenly the damage can sometime slowly, progressively affect a lot internally when they flare. Sometimes it can be a dangerous, as an organ threatening, and even a life threatening as well. So this doesn't mean if you eat this food you have cured RA. If you eat this, you cured lupus. If you eat this, you cured osteoporosis. So evidence-based medicine, as we do the x-ray, we do MRI, we do things, even autopsies find a lot of the underlying diseases. So don't mislead by those people and those persons in the YouTube or even your surroundings that if you eat this food, your arthritis will go away. There may be a slight element of the, some good effect, but overall, when the rheumatoid arthritis happen, there is no food which can cure the rheumatoid arthritis. It can sometime go in a remission naturally, but sometime very low level of inflammation can damage the joints, then your life, and the stage when you come to see the rheumatologist, your disease may be advanced. If you have lupus, you think you don't have anything, skin or joint, but it internally affect your kidneys may be damaged, and then it's certainly a difficult time or challenging things to the physician to treat you. So coming back to the point, osteoporosis, we deal a lot with the osteoporosis. People take steroids. Obviously we give a lot of steroid with the specific to specific diseases. As the world population is going, the advance in the age, geriatric population is a lot in the world. So osteoporosis is again, it can lead to fracture, morbidity, and mortality. Anyone in your surroundings, your family members, your parents, your grandparents who are age 60, and the women age 70, the male, they do need a DEXA scan as a baseline. If they have a fracture in the 40s or 50s, if there is a thyroid condition, male with the hypogonadism, if you have exposure of steroid more than 3 months, more than 7.5 milligrams, do screen this, osteoporosis. If they have ulcerative colitis, they have a lot of other associated conditions, some drugs like heparin, thyroxine medication, anticonvulsant medication, then these medication can also affect the bone mineral density. So just to summarize, arthritis is of various types. It doesn't mean one person is a one arthritis, other have similar various connective tissue diseases. Rheumatology, some conditions may be lately diagnosed, and sometime if you're not serious, if you're going on the herbs, if you're going on the home remedies, some fruits or vegetables, they are good, but alone these have no compelling indication or such studies that only food can cure. The word cure a lot of people use, which is just a misleading. There is unfortunately no 100% cure, but the diseases can be manageable. Thank you. Take care.